Welcome back, and today we are joined by Dr. Corry Clinton. He's here to talk about the type of questions that we might want to think about asking our primary care provider. Doctor, thank you for joining us today. I think most of us are so busy in our daily lives, we just kind of want to get in and get out when it comes to a doctor's appointment, and then later we start to remember things that they really should have remembered to ask. So what kind of questions should we be asking a primary care physician?
That's a great question. Often people come in and they have these things they want to talk about, and then, everything leaves you. That's kind of how it goes. Happens to me too. So first of all, it's a reasonable idea to have a list. You come in with a list. These are the things I want to talk about or that are concerning me, and we can kind of set up our agenda, what we can deal with and what we might have to do later, and kind of focus on a plan that way. Whenever I'm seeing a patient, I'm thinking, what is the problem today? Like, I'm here for knee pain, or I have abdominal pain, or what have you, or I had a really high blood pressure reading at work, or whatever today's problem is. Also, I try to keep in mind the chronic issues. Does this patient have diabetes? Do they have heart problems? Is there anything that we need to deal with today for that? And also keeping preventive care in mind. Are they asked due for a colonoscopy? Do they need a mammogram? Are there vaccines that we want to talk about? So trying to keep in the today problems, the chronic problems, and the preventive problems to keep future problems from happening. So I would recommend write down what you need, say these things are bothering me, and we can try to figure it out. If you want to have somebody come with you, that's always a fantastic thing, and they can keep things in mind and help keep things on track so we, remember everything.
I know for myself and probably others as well, when I go in to see the doctor, my heart might start to race a little bit. That makes the blood pressure a little bit off. People get a little paranoid because they're seeing numbers that are not really their normal numbers. And what can you suggest for folks when they're coming in to see a doctor?
So that happens quite a lot. We call it white coat hypertension. I'm not wearing a white coat, but it's the same thing. It's kind of like how if you're having a hard time sleeping, the worst thing you can do is look at the alarm clock, right? You come in, you're looking at the blood pressure cuff, and you start to get a bit anxious for some people, and it raises the blood pressure. That happens quite a lot. So trying to, one, make sure that you have enough time that you're not rushing to your appointment. That can be helpful. I've had people literally run across a parking lot to get in. Not the best time to check your blood pressure, maybe. We can have you wait a bit longer until you're calmed down to take your blood pressure. That's totally fine. It can be a very helpful thing to take your blood pressure at home. So I do have patients where every time they see me, it gets high, but they have very nice blood pressure readings at home. And so we have to take that into account. And if you do take your blood pressure at home, and if you have a home cuff, it can be very helpful to bring it to the doctor's office so we can compare. So we can take a reading with yours, we can take a reading with our manual devices and see how they add up and see if one's higher or lower than the other.
We've got a number we're going to put up on the screen right now for those who are watching. If they are looking for an appointment, how can they get in touch with you?
So you can just call the number down there, 877-DOC-LMPC. We have offices in the main hospital. I'm up here in North Lima. We've got folks in Kenton, Ada, Wapak, Ottawa. So folks all over. So you can find one of us that's near to you and suits you, and just call and make an appointment.
Dr. Corry Clinton, thank you so much for your time today, and we'll be back with more right after this.